Welcome to DiaryOfAPodStudent. This is week number 4 of my podiatry degree. This week in our lower limb structure and function module we had to get into groups of about 5 or 6 people, and then one person had to wear a pair of shorts. What we did was we learnt about the veins and the arteries, and we got shown these diagrams. And what we had to do was we had to cut some tubey grip up and place it on both of the person wearing shorts' legs, so they had tubey grip on both of their legs. Then we had to, in our groups, according to our diagrams and the actual anatomy diagrams, we had to draw on one leg all the arteries and where they were in the leg, and then on the other leg we did all the veins where they were. So it was quite challenging, it wasn't easy, especially when you get down to the knee area. Everything changes name, even though it's the same vein or the same artery, it just suddenly changes name for some reason. So I'll show you a picture of what the tubey grip is.
Okay, so tubey grip is just elasticated tubular bandage. It comes in different sizes depending on what area of the body you want to use it for. For example, if you want to use it on someone's toe or a whole leg. We don't want it too loose or too tight, so that's why there's different sizes. The first image is of tubey grip just in its packaging. There are loads of different types of tubey grip, so the packaging will look different. The next image is just the tubey grip out of the box, so it's just in a roll like this. Then the last image is of someone putting on the tubey grip on their leg, and this is what we did in our lower limb structure and function, and then you can just draw on top of the tubey grip as well.
Okay, so this week in our clinical session we did padding and strapping. This is a way for patients to relieve some of their symptoms. So some of the reasons why we would use padding and strapping: to relieve pressure by deceleration, relieve pressure by redistribution, relieve pressure by stabilisation, a reduction of friction, and other uses for it is to retain ointment if we've put something on the skin, or if we're using it to help with a dressing. And lastly, there is thermal insulation for people with cold feet. So they're just some of the reasons why we would use padding and strapping, and all it is are bits of foam, different types of foam, different thicknesses, different densities, and what we have to do is assess where the patient needs it on their foot, and we need to cut it to the shape of their foot. For each type of pad we have to cut out different hypoallergenic tape to different shapes and sizes, and it has to completely cover the pad. And when the patient walks out, that's something they're going to wear for the next couple of days even, and sometimes we can give them extra to keep on. It's only meant as a temporary measurement before whatever treatment it is they're getting has been sorted out. So if they're getting insoles, they'll wear that until the insoles have arrived. So I'm just going to show you some pictures in my clinical book of different types of padding. This one is the plantar metatarsal bar, and you can see here it covers the the ball of the foot, and it comes just to the top of the ball here, so not touching the toes, and then it comes down to the bottom, which is a lot further down than you actually might think. Another type is the filler pad, and as you can see here with the dotted line it goes in the arch of the foot, so if people have a high arch it just fits in nicely there. Obviously we have to cut this to shape, so we'll need to keep readjusting possibly to get it right. You can even layer up pads, so you can stick one on and then cut out another one and stick it on top if the arch of the foot is really high. So I'm just going to show you a picture of one that I found on the internet of someone using padding and strapping in clinic. So in clinic this week I was the patient in my group of people, and I had 2 people practice on me, so I had padding and strapping on both of my feet. Normally we take everything off and put it in the bin, but this time I decided to keep both the padding on because I've got high arches on my feet and I had both the filler pads in both of my feet done. So what I decided to do is test it out when I went to work that evening. It was quite interesting because it's not something students normally do. We don't test out treatments before we start patients. We just sort of get taught a few things, practice it, and then suddenly we're straight into patients already without having really done it on ourselves. It's all done on models or blocks of wax, etc. So I kept the padding on. Both of the padding were done by different people, so they felt very different. I found that a couple of hours later the feeling had changed about the padding, so it's quite interesting to see what patients feel when they walk out of the clinic. At first my left foot was hurting, and then by the end of the night my right foot was hurting because the padding had compressed and changed basically. So thank you for watching, and I hope you enjoyed my video.